Good afternoon. Today is Wednesday, October 21st. I am pleased that you've joined us. I am joined by Dr. Joneigh Khaldun, of course, our Chief Medical Executive, Pastor Dennis Clinton from the Woodland Church in Brownstown Township, and Bishop J. Drew Sheard from Greater Emmanuel Institutional Church of God in Christ. Moving forward, myself, Dr. Khaldun, and everyone who will be joining us in these press conferences will be wearing a mask for the entire duration, with the exception of our interpreters, of course, who need to have their mouths exposed to ensure everyone can watch from home. And I want to urge all Michiganders to wear your mask when you leave your home, especially when you're around people you don't live with, especially when you are in an enclosed space. I want to begin today by encouraging Michiganders to turn in your absentee ballots. Turn them into your local clerk's offices. And by turn in, I mean drop them off at a drop box or turn them in at the office. Yesterday, Secretary of State Jocelyn Benson announced that over 3 million Michiganders have requested a ballot. And as of last night, more than 1.7 million have turned those ballots in. At this point, we are so close to the election, we don't want people to rely on the Postal Service to make sure that their ballot gets in on time. So to be extra careful, hand deliver your absentee ballot to your clerk's office or a drop box. There are more than 1,000 across the state of Michigan. Vote early with your absentee ballot at your local clerk's office or at a satellite office, or vote at your polling place on Election Day, November 3rd. Registration must be done in person. So if you haven't registered to vote but you want to participate in this election, go in person this week, register, fill out your ballot all in one stop. To track your ballot and find your clerk's office or your drop boxes or polling places, you can get more information at michigan.gov/vote. This is going to be an historic election, so don't wait. And don't go when lots of people are going on November 3rd. If you can go early, I encourage you to do so. Just over 3 weeks ago, after a protracted legal battle with Republican leadership in the legislature over my executive authority, the Michigan Supreme Court, by a narrow party line majority, struck down the statute under which I had issued executive orders to save lives and to protect Michigan families, our frontline workers, and small businesses. Since that time, we have seen a steady rise of COVID-19 cases and hospitalizations. We are now at our peak when it comes to daily new cases. This peak is higher than what we saw in April. This graph shows our cases per million lined up with actions that my administration has taken over the past 7 months. The furthest line to the right shows when the Supreme Court issued their ruling. And as you can see, our cases per million since then have been on the rise. This graph shows the same timeline with Michigan's hospitalizations. And as you can see, these numbers are on the rise as well. Our numbers are climbing. We need to take this seriously. We need to double down on wearing masks and maintaining physical distancing. We all know the fall was going to bring colder weather, but we are now nearing the 2020-2021 flu season, and we're all spending more time indoors. We know that more people will get sick. We know that more people will get hospitalized, and sadly, more people will lose their battle with COVID-19. Based on what we know, a vaccine will not be available, much less widely distributed, for several months. And that's why we all have to do what we know works. And it also means that time is of the essence. We're not alone. I think it's important to note that all of our neighbors in the Midwest are experiencing a rise in cases too. This blue line that is rising significantly higher than the rest of us is Wisconsin. Their Supreme Court issued a ruling striking down the state's stay-at-home orders. And if we're not careful, and if we don't all do our part, this could be our fate very quickly as well. And that's what we're so concerned about. So while the executive orders that I issued this year to protect our families are no longer in effect, I want you to know that we still have a law that is applicable that requires wearing of masks. I want you to know that I will continue to use every tool that is available to me to keep you and your family safe. And the Michigan Department of Health and Human Services has issued a number of epidemic orders to ensure Michigan's public safety and public health. Under the MDHHS orders, masks must be worn at any gathering occurring at a business, at an office, at schools, child care facilities, sporting events, and other non-residential events. Businesses cannot admit individuals who do not wear a face covering, with few exceptions. Organized sports require face coverings and have gathering limits. And capacity limits apply to indoor gatherings. For example, except in Region 6, a gathering at a retail store, a library, or a museum may not exceed 50% of total occupancy limit. Gatherings at recreational sports and exercise facilities are prohibited if they exceed 25% of the total occupancy limit, or if there is less than 6 feet of distance between each workout station. And food service establishments cannot exceed 50% of normal seating capacity. I also signed a set of emergency rules on Friday from the Department of Labor and Economic Opportunity to secure protections for Michigan workers. Under the emergency rules, businesses that resume in-person work must, among other things, have a written COVID-19 preparedness and response plan and provide thorough training to their employees, training that covers workplace infection control practices, the proper use of PPE, steps that workers must take to notify the business or operation of any symptoms of COVID-19 or a suspected diagnosis of COVID-19 or a confirmed diagnosis of COVID-19, and how to report unsafe working conditions. Yesterday, I signed a bipartisan couple of bills codifying parts of my executive order that had extended to unemployment benefits. This is for Michiganders who've lost work as a result of the COVID-19 pandemic, and we extended those benefits from 20 to 26 weeks until the end of the year. This brings Michigan in step with most states, by the way. These bills are an important step in providing immediate relief to working families. But given the recent rise in numbers, I urge the legislature to make this change permanent. We cannot let these benefits expire at the end of this year. It's time to work together on a long-term solution for working families. Later this week, I will sign bipartisan legislation to protect workers and their families and businesses that are doing the right things to keep their employees and their customers safe. I look forward to more collaboration with the legislature where we can find common ground. So while the tools that we are using to fight this virus may be different, we all know what we must do to protect each other. At the end of the day, you don't need an executive order or a court to know what it is we need to do in this moment. The good news is that we know what it's going to take. We've done this. We crushed the curve in the spring. When we wear a mask, when we maintain 6 feet of physical distancing, when we wash our hands frequently. I also encourage you to get a flu vaccine and make sure your kids get one too. We've seen some of our leaders embracing dangerous ideas like herd immunity. Let me be clear. That philosophy is inhumane. Health experts have said that if we embrace herd immunity, 30,000 more Michiganders would die from this virus. And they stated in a letter last week that, quote, a much better alternative to herd immunity would be to control the spread of the coronavirus through policies that are based on evidence, followed by broad use of safe and effective vaccine when it becomes available. We must continue to be smart and make decisions based on guidance from the experts. The virus has already taken over 7,000 lives of Michiganders. Many of us know people who have died of COVID-19. We've experienced the pain of losing a loved one too soon. Herd immunity goes against the recommendations of health experts across the country. So let me be clear. My administration will continue to make decisions based on facts, based on evidence, and the recommendations of health experts like Dr. Joneigh Khaldun. Beating this virus will require real bipartisan cooperation, and that means listening to health experts and following the science, not denying it. I've repeatedly called on the federal government to get a bipartisan recovery package that gives support to states for our families and frontline workers and small businesses. But we have seen the Senate, U.S. Senate leadership in Washington prove once again that they're not able to work together and get this bill passed. Our leaders, from the moment they are sworn into office, have a duty to protect the people that they serve. Now, during the worst health crisis of our lifetime, they're not showing us that they can get this done. I want to thank our United States Senators, Gary Peters and Debbie Stabenow, who've been working around the clock to try to get this dislodged from the U.S. Senate. They've proven that they're willing to put aside partisan differences and deliver for the people of our state. But we haven't seen action out of the leadership. Many people have been focusing more on their election campaigns or on the Supreme Court nomination. Listen, they got to move forward on this. Lives are in the balance. There are reports about states not having enough resources to even distribute vaccines when they become available. We know that our frontline workers need additional supports, as do our kids in our schools. We need help from the federal government. But I'm not going to just wait for them to get their act together. We're taking action now to protect businesses. The Michigan Small Business Relief Program awarded $10 million in grants and nearly $10 million in loans to small businesses in all 83 counties. More than 2,700 small businesses were awarded grants through this program. And the Michigan Small Business Restart Grants, which provided $100 million in federal funding for small business relief grants, was modeled after the Michigan Small Business Relief Program based on our success. These programs were designed to help businesses that have been hurt so badly by this virus. Women-owned, minority-owned, veteran-owned businesses in particular. Michigan's food and agriculture sector has been hit particularly hard by COVID-19. So this month, my administration announced a total of 177 farms and 159 food processors have been awarded $15 million in Michigan agricultural safety grants to mitigate the risks of COVID-19 across our food production industry. Additionally, 124 small farms of less than 10 employees received $567,000 in grants for COVID-19 risk mitigation through the MEDC Small Farm Safety Grants. This program puts federal funding to work for Michigan's farms, and it builds on additional COVID-19 relief efforts led by the MEDC and MDARD to create strong foundations for Michigan's long-term economic recovery. So the hard truth that we are confronting is that this virus is not done with us yet. And the virus doesn't care about a Supreme Court decision. And the virus doesn't care which side of the aisle you are on or what political party you support. None of us is safe from this virus. But all of us know what we can do to help protect one another and our families. We know that this is a virus that preys on our older generation, a virus that preys on people with medical vulnerabilities. People 80 years and older have a fatality rate of 20% compared to 8% for people in their 70s. My administration has worked around the clock to protect our most vulnerable, and we have made great strides as a state. But all of us continue to have a personal responsibility to protect each other. Every one of us has a choice every time we go out. COVID-19 is transmitted by respiratory droplets when you are in close proximity to someone outside of your household. Wearing a mask is the most effective way you can protect yourself and your loved ones. There are still some leaders who won't follow the science or encourage Michiganders to wear a mask. I reiterate my calls on the legislature and Republican leadership to issue a mask mandate for the Capitol and urge people everywhere to follow the law and mask up. Our lives are depending on it, and our livelihoods are depending on it. We don't know when a vaccine will come, and distributing it widely to all Michiganders will take some time. But we know right now we can protect one another. As it gets cold outer and we start spending more time inside, this virus will spread and worsen. And as we think about the holidays, think long and hard about how we're going to spend them. We love our families. Let's protect them. Do your part, please, and wear your mask. And with that, I'll hand it over to Dr. Joneigh Khaldun. Thank you.
Good afternoon, and thank you, Governor. We are at a critical time with COVID-19 across the country and here in Michigan. There have been 8.1 million identified cases of COVID-19 in the United States and 219,499 deaths. And most states in the U.S. are now seeing a surge in cases. Michigan is not as severe as many other states, but we have many reasons to be concerned. We are now at, as of yesterday, 149,392 total cases and 7,053 deaths in Michigan. Our data and rates are changing daily, as they have across this entire pandemic. Our case rate is now at 131 cases per million people per day, which is over 80% more than just 1 month ago. We are doing well, and this is good news. We're doing well with testing, and we're at 35,300 tests per day over the past week. However, I'm concerned that we are seeing the percent of those tests that are positive going up. That rate is now 4.9%. That's an indication that we are seeing community spread across the state. Case trends are also differing regionally. The Upper Peninsula region has a rate of 337 cases per million people per day and has 9.3% positivity for tests. The Kalamazoo region has 211 cases per million and 6.7% of tests in that region are positive. The Grand Rapids region is at 155 cases per million and is at 4.6% positivity. The Detroit, Saginaw, Lansing, and Jackson regions have more than 70, but less than 150 cases per million people per day. The percent of tests that are positive in those regions is between 2.6 and 4.4%. The Traverse City region remains our region with the lowest rate at 62 cases per million people per day. However, positivity in this region is 3%, and both the case rate and the positivity in the Traverse City region have been increasing over the past 2 weeks. All regions of the state, as the governor mentioned, have seen an increase in hospitalizations over the past 3 weeks. 58% of those hospitalizations are outside of Southeast Michigan. On average, 8% of inpatient hospitalizations are for COVID-19 across the state. Deaths are also slowly increasing. A month ago, we had a 7-day average of about 9 deaths per day. As of October 18th, that number was at 15. Again, that's very concerning. As has been the case throughout the entire pandemic, contact tracing is incredibly important. We must quickly identify positive cases, make sure they are effectively isolating, and reach out to their close contacts. In the last 30 days, there have been nearly 30,000 positive cases reported in Michigan. Between state and local case investigators, 57% of those positive cases had an interview successfully completed within 24 hours. Over the past 30 days, nearly 35,000 contacts of those positive cases have been referred to the state's contact tracing platform. We've been able to identify nearly 30,000 symptomatic contacts through our contact tracing efforts. Again, this is incredibly important. Please continue to answer that phone call or that text message if a state or local health department staff person reaches out to you. I also want to talk about what we're seeing with outbreaks. Local health departments are now investigating 393 outbreaks across the state, and that number continues to grow every week. Top categories for outbreaks remain long-term care facilities, educational settings, and social gatherings. We're also seeing many outbreaks associated with religious gatherings. We now know of 18 new and ongoing outbreaks that local health departments are investigating in this setting. These outbreaks have significantly increased since September, and I want to talk a little bit about this. In these incredibly challenging times, it is critical that people have social supports. And I know that being part of a faith-based community can be an important part of that. But we have to remember that this virus is still very active, and it's always looking to infect people, no matter the reason for the gathering. So please be careful, please wear your mask, and maintain 6 feet of distance between yourself and others, even in these faith-based settings. These are challenging times, and the virus is spreading, but we really should not feel helpless. We have what it takes to get control of this virus, and we've done it before. There's basic things that everyone can do to protect themselves and to protect their communities. As the governor has said, and I've said many times, be sure to wear your mask every single time you're going to be within 6 feet of someone else who's not a part of your own household. That means in your own home, that means in the homes of your family members, the homes of your friends, every single time. Avoid gatherings as much as you can. The smaller the better. Outside is better than inside. And if you must have a gathering, please maintain 6 feet of distance between yourself and others. You also need to know that just because something is permitted, it does not mean that it is a good idea to do it. Limit indoor dining with anyone who's not in your own household. And if you choose to dine indoors, keep your mask on at all times, except when you are actually putting food in your mouth. And limit your talking. Talking without a mask on increases the risk of spread. If you have a choice between dining in a restaurant or getting takeout, strongly consider getting takeout. If you have a choice between going to the movies or renting one at home, strongly consider renting one at home. Wash your hands frequently or use hand sanitizer. And please, again, get your flu shot. I also want to make sure everyone is taking care of their mental health. It is totally okay to feel stressed and overwhelmed right now. It's been an incredibly challenging year. But make sure you're eating well and getting enough sleep. Find time to exercise. Even 10 minutes of exercise is something. And reach out if you need help. You can start with our website, www.michigan.gov/staywell for more resources. We're all in this fight against COVID-19 together. This virus doesn't care about your skin color, it doesn't care about a Supreme Court order, it doesn't care about your political affiliation. The more we can all come together and do the right thing, the easier this will be and the more lives that will be saved. And with that, I will turn it over to Pastor Clanton. Thank you.
Thank you, Doctor, and thank you, Governor Whitmer, for inviting me over today. When we began to realize the seriousness and the consequences of the coronavirus, our leadership team at Woodland Church began to prayerfully consider how we could continue our services and minister to our congregation and support the ministries not only in our community that we support, but our ministries that are around the world. We had to consider what the book of Hebrews teaches us about the gathering of the church. It's not an optional thing for the body of Christ. The Bible tells us that when we gather, we literally gather in the presence of God, along with myriad of angels and the spirits of our parents and grandparents who have already gone on to be with the Lord in heaven. We literally come, the scripture says, before the blood of Jesus, where we can embrace his loving forgiveness. So we had to address these convictions prayerfully, biblically, historically, and ethically. March 22nd was our first completely virtual service, and I will confess to you it was strange to preach to an empty sanctuary with a few technical people there to help. But I believe that what helped us was the overwhelming conviction that we had that this was a part of being considerate of one another. As we worked through it, we were able to come up with a successful vision of what we needed to do for ministry to take place. It's important to understand that when we first began, no one in our congregation or fellowship was sick. But by late March and early April, we were confronted with our first victims from our congregation. My family and I had just shared communion with one of our elderly members, a personal friend, a dear friend. He was an immigrant from an island nation. He came, made a wonderful living, raised a wonderful family, and was a passionate follower of Jesus Christ. Within just a few days after celebrating communion with him, he was in the hospital where none of us nor his family could touch him. And just a few days later than that, we had the first of a number of funerals that I've had to preach in our community and from our congregation. During the coronavirus, we have learned how to lament. We have learned how to grieve together. We have wept, but we've also given thanks for those in our congregation that were infected and are recovered or still recovering. And when we were told that children could not be infected, our youngest grandson, 3 years old, Josiah, whose name means the Lord heals, was admitted into the intensive care with the coronavirus. We're so grateful to God and to the doctors that he is doing well today and very active. What we have learned from not only the scriptures, but from the guidelines of the CDC and the governor's coronavirus website. We've consulted with healthcare professionals, attorneys, and with our insurance company so that we could study how to come back together and do life as a congregation, both virtually and on our campus. So after a great deal of research, we are doing both. We have social media platforms that we use, not only for our main services, but for our ministry groups, our small groups, and also for our prayer services on Zoom and FaceTime. In June, we began meeting outdoors on campus for 2 Sunday mornings as well as virtually. In August, we began our youth ministries and children's ministries with social distancing, masks, and taking temperatures. In all of our services, we require that families socially distance by family units. We currently limit attendance to 100 people per service, and we request that you register before the service. We take communion weekly. That's the Lord's Supper, and it's prepackaged. You pick it up. We don't serve it. We also have online giving, and we also have the thing that has been the most difficult for me, and that has been no handshakes, no hugs. Recently, I preached a funeral, and after the funeral, suddenly people came up to hug, and it felt so difficult to say no, but it was for their sake that we did. Each of our buildings are sanitized in between services, as well as our facilities, and the pew alterations are made so that folks can sit safely in a service. And we have a plan for returning back to a totally virtual service if we need to. Governor, I want to say thank you for your love and your care for the citizens of Michigan. I want to say thank you especially to the wonderful congregation and community I serve and live in Brownstown for their support during these difficult times. God bless you all.
I am Bishop J. Drew Sheard, the senior pastor of Greater Emmanuel Institutional Church of God in Christ in Detroit, Michigan. And we have been closed to public worship since the 19th of March. It is important to me to do everything we can to attempt to save our people from contracting COVID-19. We encourage our members to participate in online worship, and we were able to have a few what we call pull-up worship services where people were encouraged to stay in their cars and worship. We yet have several food giveaways at the ministry, but At all times, we practice social distancing and the wearing of masks. We have attempted to abide by our governor's suggestion, and thus we've been very successful. I have not opened up as of yet, even though we learned that 25% of a venue's capacity was acceptable. Unfortunately, I am yet uncomfortable. I want to commend Governor Whitmer for her aggressive approach in trying to save the lives of Michigan citizens. Unfortunately, my family has been victimized by this virus. I lost my dear mother in April. I saw its devastating effect on my father, who has miraculously recovered, thank God. And it also attacked my brother, my son, and my daughter, who have all recovered, thank God. So I encourage everyone to wear a mask and practice social distancing. I also encourage every pastor to take every precautionary measure to ensure the safety of their congregation. Thank you, and God bless you.
I want to thank our guests today, Pastor and Bishop. Appreciate them sharing their personal experiences and stories of how they're continuing to support their membership. During stressful times like this, staying connected, even though we have to stay apart, is really important, as Dr. J mentioned about the toll on mental health. This is an ongoing challenge that we are confronting, and we're going to confront it together, and we're going to get through it together. With that, I'm happy to open it up for a few questions. Ready, Emily? All right, we got that volume up.
Based on what you know right now, how close are we to shutting down any portions of the state? And you eventually have to know that public legislature along with you.
Okay, so I believe it was Tim Skubic who was asking about where we are in proximity to the possibility of a shutdown. Tim, I appreciate the question. I don't even like repeating it because I know that some people will attribute just those words to me and start to create a lot of anxiety. I'm just going to be frank. Our numbers are not good. They're moving in the wrong direction. We know that our fate can change quickly, right? The actions we're taking today, we will see show up in terms of our testing in a couple of weeks. A couple of weeks after that, we'll see what it means in hospitalizations. That's why we are sounding the alarm bell right now. These numbers are moving in the wrong direction. We are at a dangerous moment where there's the possibility of it just becoming community spread that becomes out of control. We're seeing that in a lot of our neighboring states. That's what we're trying to avoid. That's why we're trying to call on people and appreciative for the partnership from the business community and the MERC, which has weighed in. We've got to get the partisanship out of the conversation around our public health. And we've got to take the masking seriously. We have to take preparations for this fall and holidays that are coming up. You know, if you are in a room with people with whom you don't live, then you need to be wearing a mask to stay safe. That is a dangerous thing, is to be inside and to be unmasked. And so we're sounding the alarm bells. We want people to know we're watching these numbers very closely. We're continuing to do the tracing. We're working with our local departments of public health who are doing an amazing job. But at this point, I don't think that I can tell you precisely what the next week or the next 2 weeks look like. It depends on individuals right now rising to this challenge. The good news is we have shown we can do this. We have done it before. And at this juncture, it's just crucial that we all do our part, because if you want your kids to have the prospect of in-person learning, if you want to stay back at work, if you want to keep your business open or make sure that businesses stay open, every one of us has to do our part.
Okay.
All right, I should have noted that we don't have a lot of time for questions, so we'll just take a couple more. So the next question will come from Jim with TV7.
Good afternoon, Governor. An open letter went out earlier today that's been signed by business leaders, union leaders, university leaders, healthcare leaders, that essentially says, the letter says that they want you and the legislature to work in unity, that the agencies that have issued continuing orders are working, but we now need the spirit of cooperation, focusing on reining in surging case levels, and we call on government leaders to foster that unity. So my question is, can you give the state right now a sense of how close you are with unity with the Republicans in the legislature, how far apart you are? You talked about herd immunity. Can you give the state a sense on this unity working with the Republicans moving forward in this crisis?
So I'll say this, the Merck members and actually a larger contingent of leaders across the state have written encouraging the legislature to work with us on the actions that the Department of Health and Human Services has taken in terms of the mask mandate, in terms of the prohibition on gatherings over a certain size. And I'm grateful for their partnership. They've been working alongside with me throughout this crisis to make sure that we're promulgating protocols to keep people safe as our economy re-engaged. And they've helped inform a lot of the decisions that I've had to make. We all recognize that the Supreme Court decision has created a lot of confusion. We also recognize that there are some things that we are going to have to work together on to make sure that we address. For instance, the unemployment bills that I signed yesterday. Another example is the ability for local bodies of government to meet without meeting in person. These are important examples, but really encouraging all leaders to recognize the science and the importance of these DHHS orders that mirror the executive orders that I had in place, specifically the masking requirements, specifically the requirement on limitations on gatherings. These are the science-based practices that I think business leaders recognize are really crucial right now more than ever. And they're all seeing the numbers rise. The Merck has got representation from some of our large health and hospital systems to our leaders of big institutions like our universities, as well as leaders from various businesses that have global presence. They're all worried about where our numbers are headed, and that's why we're all trying to make sure that we work together, we follow the science, and we lift up the spirit of the law, which is the orders that the DHHS department has issued.
Okay, great. We'll take two more questions. So the next one will come from Eric Lloyd, TV 9 and 10.
Hello, Governor. Excuse me if Dr. Khaldun had said this before. We couldn't hear it very well when she was talking. But we're seeing a hotspot in the Upper Peninsula. And early on, the big worry was the rural areas not having the hospital space. So I was just wondering if we could have an update on how hospitals are doing in areas like the Thumb and the UP and other places.
Eric, I'm going to step away and let Dr. J take your question.
So I think the question was, how are hospitals doing specifically in the Upper Peninsula? So yes, we continue to be concerned about our hospitalization rates. As I mentioned during my remarks, a lot of the cases and the hospitalizations are outside of Southeast Michigan, which we know has more hospital bed capacity than other parts of the state. So we're working very closely with our hospital partners. We have regional healthcare coalitions as well, making sure they have ventilators and staffing to be able to support patients who have COVID and those who don't have COVID. As of right now, we are seeing increasing hospitalization rates, but I believe they still have it under control and manageable at this time, but we will continue to monitor and support them.
Okay, great. So the last question will come from Ben Henry.
Governor, on Monday, there was a campaign call leak from the Trump administration that basically called Dr. Fauci a disaster and other health officials idiots. What do you make of that? Yeah, I was just wondering what you make of that, and also if you have any concern of people taking that and not masking up.
I appreciate the question about Dr. Fauci and the Trump administration treatment of him in the last few days. I want to acknowledge that our public health experts are not political people. They're scientists. They're people that go into this work because they want to protect others. This is public service at its very best. We are in the midst of a global pandemic. The people that we should all be revering, respecting, and listening to are our scientists and public health experts. That's why Dr. J is always by my side, because I respect and recognize that she has an expertise in saving lives that needs to inform each of the tough decisions I've had to make. I think Dr. Fauci, having served 6 administrations, spanning all sorts of different political environments, is one of the most well-respected people in this space on the planet. Efforts to undermine the work that we're doing, I think, is really dangerous. And it broke my heart to see that even he has had to beef up his security because of the vitriol and the attacks. I think this has to stop. And obviously, this is something that is personal, as I've worked so hard to save lives here in Michigan and have been the subject of some of that myself. We know that it's not limited to me. And any efforts to continually discredit work that's based on the science puts us all in danger. And so I'm hopeful that it stops, and I think that it's a critical moment. And I just want to acknowledge one more thing before I leave the microphone. One of my very best friends has COVID-19 right now. And she is 49 years old, one of the healthiest people I've ever known. No one else in her family has it, and they've been careful. And it's very scary. And that's why I just share that personal connection right now in this moment. We are all tired of this. I am too. It's hard. It's taken a toll on all of us. And our frustrations are very close to the surface. And yet we are not done with COVID-19 because it's not done with us. We're making progress in terms of therapeutics and the race to get vaccines. And I'm hopeful that there will be some in the very near future. But right now is a very dangerous time here in Michigan. Our COVID cases are rising all across the state. We will see our hospital cases continue to rise. And sadly, deaths continue to rise as well. We know what it's going to take to get these numbers down. None of us wants to take steps backwards. None of us wants to lose a loved one or to be battling COVID ourselves. So please, let's show the grit and determination that we showed this spring when we pushed our numbers down and we took care of one another. Let's mask up. Let's be smart. Let's stay physically distant, but not emotionally distant. And let's make sure that we take care of one another and take care of our economy as well. Thank you, everybody. We will see you very soon.